Hey guys, welcome to my channel, Medical Assistant with Miss K. If this is your first time visiting my channel, welcome. I'm Kendra, aka Miss K. I'm a medical assistant instructor, and I'm also a CPR and first aid instructor. So somebody left the question, what is the difference between an administrative medical assistant and a clinical medical assistant, and which one should I choose? Now, let me just start with differentiating between the two. Now, most of the time when we hear the term medical assistant, you know, we tend to automatically think about the clinical medical assistant, right? We think about the one that's in the back office assisting the provider, the doctor, right? Or the nurse practitioner or physician assistant. Now, that's a clinical medical assistant, right? So if you're on the administrative side, you're also a medical assistant. You're just an administrative medical assistant, okay? And what's the difference? Again, the clinical medical assistant, they're the ones in the back office directly assisting the provider, okay? And think about when you go to the doctor's office, think about that person that brings you to the back to find out what you're coming in for. They're doing all your vitals, meaning your blood pressure, pulse, respiration, and checking your height and weight, right? If you need an injection or you need some blood drawn, they're most likely doing that as well, right? EKGs, collecting urine samples and stuff like that. So we are directly assisting the provider, and essentially our job is to make their jobs easier, right? We also assist with certain procedures. Now, clinical medical assistants can do a lot of what nurses do, and I'll actually do a separate video because I have gotten that question, the difference between a medical assistant and a nurse. We are not the same. Medical assistants are not licensed, and there are a lot of things that nurses do that we cannot do because it is outside of our scope of practice, okay? So I'll talk about that in that video. But anyway, so you get the gist of a clinical medical assistant. So they're directly assisting the provider. Now, the administrative side, think about the person that maybe answered the phone when you called and scheduled your appointment, and the person that's checking you in when you come in, right? They're at the front desk. If you have a co-payment, they're taking your co-payment or any other payment you may owe. You know, they are collecting your insurance information, your demographic, meaning your name, date of birth, your insurance information, and all of that good stuff, right? That's the administrative medical assistant. There may be, you know, some billing and accounting duties that comes along with their job. So the administrative medical assistant, they are all on the administrative side. They're not directly dealing with the patient hands-on, right? Now, and I will say this, because when it comes to choosing what's right for you, it's going to simply be up to you and what you want to do. I will say that the advantage of becoming a clinical medical assistant is that you do learn both front and back office. So you can do both. You can do the front office, you can do the back office. If you go to school to only become an administrative medical assistant, you will only learn the back office, and anything clinical will be outside of your scope. So if you know you want to do a little bit of both, clinical medical assistant is definitely going to be for you. If you know you're that type of person who, you know, I want to work directly with the doctor, I want to, you know, get my hands dirty, not in the literal sense, because you definitely don't want to get your hands dirty and soiled, right? But if you say, I want to be hands-on, I want to take care of patients, and, you know, I want to assist with the doctor in certain procedures, you know, I want to draw blood, I want to do EKGs and all of that good stuff, then you know that clinical medical assistant is for you. And I will say, be prepared when you go to school, because I get some students who don't realize when they come to school that they learn all of these skills on each other. So just be prepared for that if you do go to school for clinical medical assistant, because you got to learn, right? You got to learn somewhere. If you know that you don't want to have direct patient care, but you want to, you know, you want to schedule appointments, you want to be on the administrative side, answering phones and assisting patients in that way, then administrative medical assistant may be for you. So I hope that this video was helpful. I hope that this helped anyone that may have been thinking about whether they want to do the administrative side or clinical side or both. If you have any other questions, of course, you can feel free to leave that down below. My email will also be down below. I also have a medical assistant Facebook group for those of you that are on Facebook and want to join. I'll link that down below as well. Thank you again for visiting my channel. Be blessed.